Health Organization again is saying that if you're not symptomatic and not in close contact with a patient with known COVID, then don't wear a mask.
And welcome to another session of Subject Matter, the show where we talk to everyday people about everyday things. Today we're at the Knysna Life Private Hospital, just next door at the rooms of Dr Visagie, who's going to talk to us a little bit about COVID-19. And as you could see from the intro, I couldn't just enter the premises. I had to have a whole decontamination on my hands, although I wish they could have done my whole body, because I've been touching metal the whole morning. Dr Visagie, thank you so much for joining us. We appreciate your time. Cool. So the media has created an incredible amount of hype. At the moment, I think I'm more afraid of the media than I am of the virus, because the media spreads way quicker. The cancelled world sporting events. The University of Stellenbosch yesterday cancelled all public gatherings up until the end of June. The kids' school is saying when they close, not if they close. So this is like a really serious thing. What is the difference? What is? I was told that COVID-19 is a novel coronavirus. What does that mean?
Okay, so novel means new, and coronaviruses have been around for a very long time. And a new virus is usually one that starts in an animal. We've had the SARS coronavirus, we've had the MERS coronavirus previously, and a few others as well. And this virus also mutated probably from an animal source, which at the moment we're not sure which animal. And then was transmitted to
load shedding.
humans.
I'm just saying, it doesn't get worse. The markets have crashed, it's load shedding, and we've got the coronavirus. Okay.
So yes, so it's a new virus that's previously been found in humans. And the problem with that is we don't have any immunity, and we don't know what the virus is doing because it's new.
Okay, so if I can, so from animals to human, can animals get it from humans?
Probably not.
Okay.
Again, it is a new virus. There's not really research on that. We don't even know which animals are affected at the moment.
Okay.
But it's unlikely that it's domestic animals. It looks like it's it won't be your house pet that's going to infect you.
People, the elderly and people with compromised immune systems are at high risk, and they throw this high risk word around. Does that mean death, pneumonia, organ failure? What is high risk? Are we going to die?
Yes, high risk does mean higher risk that you catch the disease, first of all, and then also high risk for complications. At the moment, the good news, if there's any good news about it, is that children seems to be least affected.
Okay.
So the stats shows that there actually hasn't been any deaths in, I think, under 3 years old. Okay. And then like very low percentage of children under 18 that get seriously ill.
Okay.
Unfortunately, yes, the older population is definitely at risk. I think in Italy, the stats show that the average age of deaths, people that die is 81.
Sure, okay.
So it's quite skewed towards that. All the graphs you can see literally as you age, probably from around 60, 65, the graph goes up in relation to death rates.
Yeah.
And obviously you're more seriously ill, more complications. And then immunocompromised, which in the South African context is obviously quite a problem with our HIV patients, with TB patients.
Okay.
Again, if you're on treatment and your viral load and things are up, then viral load is low and CD4 is up, then it shouldn't be a problem. But we know that there are a lot of people that's not tested, and that doesn't maybe not know that they're infected, and that might be a big problem.
Okay. A normal flu can turn into pneumonia. So an 81-year-old who gets flu, it then turns into pneumonia, they have a high risk of death as well. So it's kind of like the same thing here. It's just that we don't understand this virus, so it makes it a little bit more scary.
That's part of it, but yes, there's also definitely a higher mortality rate with COVID-19.
Okay, so there is.
Definitely, yes.
Okay.
At the moment, stats differ by country, which is quite interesting as well, and we're not sure why. But anything between 2 and 6% of people that get ill do catch it, whereas with flu, we're looking at about 0.1%.
Oh, okay, so that's been cleared up. Okay, that I read a report. I received the Daily Maverick every day, and about twice a day they do something on COVID-19. And they were saying, I think it was in that report, that they were trying to figure out why in China men over the age of 80 were dying and women weren't, but it's because there were 90% of the men in China smoke or have smoked for a very long time. So smoking compromises your immune system?
Definitely.
Okay.
Your lungs specifically. And we know that COVID-19 affects the lungs.
Right.
I did read an article yesterday as well that says that estrogen definitely has a protective effect against flu, and they think then against COVID-19 as well.
Excellent, ladies.
So, yes, there's something for us.
Oh, woo. Okay, and pregnant women as well. Apparently, they're actually not taking it so badly.
It looks like they're doing well in this epidemic, yes.
Wow. Okay. There's a question I want to ask. Asthma. And same thing as smoking. You got a problem. You got the lungs are affected.
If your asthma is under control, then probably you won't have a much higher risk than anyone else.
Okay.
So again, as long as your sickness is under control, you're taking your medications, you haven't had acute exacerbation,
yes,
then you should be fine.
Okay. So a compromised immune system could also, so if, say for example, you have a heart disease, can that also be constituted as a compromised immune system?
Yes. So at the moment, it's like definitely any heart disease, so heart failure, recent heart attack, that type of thing, and also uncontrolled hypertension.
Okay.
And then the other things I think we've mentioned, smoking and all of that.
All of that. How long does the virus stay in your system?
Difficult question to answer.
Yeah.
Again, there hasn't been much research about it. At the moment, they're saying that in a patient with mild symptoms, it takes about 2 weeks to clear. In more severe illness, it can take up to 6 weeks.
Okay.
For those that
now, I've read that you can be infectious for up to 29 days. I mean,
yes and no. So the incubation period is anything from between 2 to 14 days.
Okay.
So you get symptoms if you're exposed. It takes at least 2 days, sometimes up to 14 days to get symptoms. And then there's this question if you're contagious before you get symptoms.
Right.
So you can't really tell. But there is a risk of that. So that's the first problem we are dealing with. And then obviously once you get symptoms and you're diagnosed, then the disease takes about 2 weeks in a relatively well person with mild symptoms to resolve.
Okay.
At the moment, the guidelines are that if you test positive, then you have to have 2 negative tests 24 hours apart before you can be confirmed negative.
So after the disease.
After the disease. So that comes in obviously if you're either hospitalized or in self-isolation, you need to get 2 negative tests before you're allowed to step out of the house again.
So it's a tough game, this. Okay, tell me about hygiene. Everyone's now suddenly, for the first time in their lives, washing their hands. We would have thought we'd be washing our hands before we got this issue. But I was told by someone who's someone is a virologist, that when you sanitize, you've got to do it hard, and you've got to press down, and you've got to get in the cracks of your fingers. How do we sanitize?
So there's the 2 options, the water and soap, and then hand sanitizer, the alcohol-based ones that you can carry around.
Okay.
So hand sanitizer is very convenient, but the first option is washing with water and soap.
Oh, really?
They say copious amounts of soap and water, and for at least 20 seconds.
Okay.
And then there's a lot of YouTube videos you can Google. The World Health Organization also has one out where the director shows you exactly how to wash.
Okay.
But yes, both sides of the hands, in between the fingers, underneath the nails, palms of the hands. So make sure you cover everything.
So basically, So basically, you're washing as if you're scrubbing in. Should we wash elbows?
Yes. Not really. The main thing is about touching your face. So you're washing your hands.
It's a difficult one.
So that if you touch your face, you don't contaminate.
Okay.
And then with the hand sanitizer issue, bacteria respond well to hand sanitizer.
Okay.
Viruses, you need to wash quite vigorously with hand sanitizer to clean them off.
Okay.
If you buy hand sanitizer, at least 60, probably 70% alcohol.
Okay.
Most viruses only get killed off with 90% or more alcohol.
Okay.
Which in the end, your hands are probably not going to survive if you,
Yes,
you do that all the time.
I was
so
wondering,
that's the
don't
problem.
we have certain bacteria or stuff on our hands that needs to stay there that we're killing off?
Yes. But again, as long as you don't wash your whole body with it,
Okay.
then they will spread again from your upper
Okay.
arms. The good bacteria will recolonize.
Okay. How do you test for the virus?
Okay, so we need to do a swab. You
Mhm.
do a nasal swab through the nose and then
Mhm.
at the back of the throat.
Okay.
And it's a PCR test. So you literally test for the DNA of the virus.
Okay.
As of, I think, 2 days ago, both Pathcare and Ampath is also doing the tests.
Okay.
So it makes it a little bit easier with the process.
Sure.
And most medical aids do pay for it.
Mhm.
Cash price is, I think, around 1,200 Rand.
Wow, that's quite expensive.
That
Because
is-
one of my questions was going to be, should we not just go and test every 2 weeks? While this pandemic is
Yeah.
around.
There's two problems. The one is if you have to pay for it yourself. So if you don't have the finances to pay, obviously the NICD is
Yes.
also doing testing.
Yeah.
It's just a little bit a longer process, and it looks like the results take a day or two longer to get the results.
Okay.
The problem with testing everyone is we don't have enough tests.
Sure.
So at the moment they've got strict criteria as to who may test, even in private.
Okay. So yeah, I mean, so I can't just come and have a test now.
No.
Unless I pay cash dollar.
Even paying, you
Oh,
still
really?
need to
Okay.
fulfill the criteria.
Okay, so you have to justify why
Yes.
I can have a test. My kid has a sore throat. What do I do?
So-
He hasn't been exposed to anyone traveling besides his mom, who's just come back, but that's domestic. And kids at school, snotty noses. So do I panic?
No, not at the moment.
Okay.
As of yet, there hasn't been any local transmission in South Africa. So all the
Okay.
cases in South Africa is people that were traveling overseas.
Okay.
So it's not in the community yet,
Yet.
as far as the stats show at
Scary.
the moment.
Okay.
It most likely it will come. We're
Yeah.
doing our best to try and postpone it and prolong the time we have to prepare for it. But as we can see in all the other countries, it probably will come to our community as well.
Okay.
So at the moment, if you haven't traveled overseas or had a close contact with someone that's very likely or confirmed COVID-19,
Yeah.
then you don't need to worry about it.
What you don't really know, excuse me, yesterday I was in the supermarket and I was waiting with my trolley and I'd sanitized everything, wearing a scarf, like covering my mouth. But this lady leans over me to get something from the counter next to me, and she blew her nose at the same time. I was so angry. But you don't know if you're coming into who knows? Maybe she's just come from overseas.
Yeah.
You don't know.
We don't know. At the moment, it's a very low risk in South Africa to catch it from someone in the supermarket or anything like that.
Okay.
Simply because we know that the numbers are still very low, and
Right.
they're doing very good tracing of all contacts.
Okay. Do we need to stock up on masks, sanitizers, and things like that? I mean, we
Masks-
can't because it's all empty now.
It is all empty.
Yeah.
That is a big
Do
problem.
you have enough masks?
The hospital's got enough masks.
Okay, cool.
Yes.
Yes.
Yes. The World Health Organization again is saying that if you're not symptomatic and not in close contact with a patient with known COVID, then don't wear a mask.
Okay.
And there's a few reasons for that. In the Asian countries, they tend to wear masks a lot more.
Anyway. Yeah.
So at the moment the guidelines are not to wear a mask except if you are ill.
Okay.
Reason for that, one of the reasons is if you wear a mask, it's uncomfortable. You tend to touch
Yeah.
your face
And
more.
exactly. Yeah.
And when you
You
can't
sweat
eat, you
inside
can't,
there.
so it's
Yeah.
on and off the whole time. So it's probably actually might increase your risk to catching a virus. Hand sanitizer, I think it would be a good idea to
Yes.
get just a few in your pocket.
Yeah.
And not to use it all the time. If
Really?
you go out to the shops, when you're done shopping, clean
Yeah.
your hands.
Yeah.
But
But don't touch your face.
don't
before
touch
then.
your face. Yes.
Yeah. Or at all.
So get into the habit of washing your hands as often as possible and not touching the face.
I was at the airport last night and there was a couple and they had masks on and they had gloves on. And I mean, they were very proud of themselves, you know, because they're just not going to get this thing. But everything they're touching so confidently with their gloves. But when they get to their hotel room or wherever they're going, they're going to take those gloves off. And everything that they've touched, I mean, would they have to wipe it all down? Does it work?
So yes, so gloves are not recommended.
Oh, really?
Simply because of the reason that if you touch something, again, you tend to touch your face,
Yes.
even with gloves.
Yes.
So it's exactly the same, whether it's on your hand or on the gloves. And again, you're touching your husband, you're touching your kids.
Yes.
So
Yes.
that doesn't help.
Okay.
And it actually is sort of, you get a false pretense that you're safe.
Yes, but
whereas
actually,
you're not really.
So I attended a conference the other day, and Dr. Mole Michael Mole was chatting about this COVID virus thing, and he was saying that a compromised immune system is also an immune system that is under stress. If you are highly stressed, you are compromising your immune system. So we're receiving all this feedback from the media, and there are a lot of stressed people out there. What do we do to maintain our immune systems? Do we take vitamins? Do we come for a B12? What do we do, and what can we take to make ourselves strong, solid?
The study showed definitely vitamin C and probably zinc might also be a good idea. Zinc dosages have been more proven in case you've got flu, then it does shorten the period. Vitamin C definitely has a protective effect in high doses.
Okay.
So again, guidelines vary. Some people say there's already a benefit, about 200 milligram of vitamin C, which is very low dose. Other studies says 3 to 4 grams of vitamin C a day.
Grams.
So that is one thing that I would advise. So you've done very few side effects.
Yeah.
So
you would advise. Okay. And that it's called vitamin 2000 or something like that. It's a powder form. So just one of those a day should keep the doctor away. Hopefully. Okay, cool. Baby wipes, there's no alcohol in them because they're for babies. Should we wipe down our laptops before we get to work or when we get to work with these things or not?
No. If you wipe with something, it has to be with a detergent.
Okay.
Something, either ammoniac or alcohol. So the baby wipes will not do the trick.
Okay. So the Dettol ones, would that possibly work?
Dettol ones, let me just check. But yes, it says 99% of germs, which they probably refer to bacteria.
Yeah.
But something like that would be a
But they packaged and marketed this before COVID-19. So
yes.
Okay. And then this is a hand sanitizer. So when you put it on, you just put like what, a drop?
Yes, but that's a good amount.
And then you just rub it in and hard.
And between the fingers.
And for how long?
Also about 20 seconds if you can.
It's a massage. It's fantastic.
Yeah. So make sure you put enough on so that it doesn't dry off before you wash everywhere.
Oh, okay, cool. Okay, so I don't even think that was 20 seconds, but okay. My skin is looking red and white at the moment. It's definitely a lot cleaner. Okay, and then just this one. So I went to Knysna Chem. It's not advertising, but I did, and they've run out of sanitizer, as everyone else has, and he has made this. It says contains 99% alcohol. It feels awful when you put it on initially, and then it just has this soothing something inside it. So 99% alcohol. This is your ideal. I got this at Knysna Chem, just FYI. Okay, what I do want to ask you, if we have flu, correct me if I'm wrong, so you get a cold, you stay at home, sometimes it turns into a bit of a chest infection or it affects your chest, but you stay at home and you self-medicate. If it's bad after, say, 3 days, then you usually come to the doctor and you get an antibiotic. Is that because you've got a bacterial infection? It's because of bacteria, right, that we can get an antibiotic?
Yes.
Okay, right. So when God forbid, someone has the COVID-19 virus, they come in here, it's flu-like symptoms, are you going to give them an antibiotic? How do you treat it?
So we need to make a diagnosis first.
Okay.
So obviously as a doctor with the flu as well, if you come in after 3 days, it's not a guarantee that you're going to get an antibiotic.
Yes.
Doctor will examine you and see if it is necessary, if there's a secondary bacterial infection.
Okay.
With COVID-19, they say up to 10 days high-grade fever, which is
Wait, so you've had a fever for 10 days?
Yes.
Can one have a fever for 10 days?
Yes.
Oh my gosh. I've had a fever for 24 hours and I thought I was going to die.
Yeah.
Okay.
So COVID-19 is a prolonged illness.
Right.
So we won't be able to say after 3 days, if you're not better, then something else is going on.
Okay.
It's probably still COVID-19.
Okay.
But that's where the importance of testing comes in.
Okay. And it's possible that you can actually have the virus. They can pick up the virus inside, but you've got no symptoms. Is that true?
That is true, although they do say most patients that tested positive while being asymptomatic eventually did develop symptoms.
Okay. So it will come
Most
through.
probably, yes.
Okay. All right. Is there anything else that you can think of that you want to add?
I think for me the most important thing is what to do if you think you've got COVID-19.
Oh gosh, I didn't ask the question. That is so funny. And I put it first on there. I thought, no, I'll put it at the bottom. Okay. Yes.
So
What do you do?
I think the important thing is please call.
Yeah.
So
don't just arrive at the doctor.
yes.
Okay.
As you saw today, we are very prepared here.
Yes.
Every patient that comes to Knysna Life Private Hospital will be screened, and if you've got any travel history or anything,
Okay.
you will be sidetracked to our isolation room and seen there.
So we've already got an isolation room set up at Knysna Life.
Yes.
Fantastic.
But if you call us ahead of time, then we just have time to prepare, and we know
Sure.
you're coming,
Yeah.
and we can make sure that no other patients are exposed.
Okay.
The major thing is if you have any travel history, anything, if you're asymptomatic, there are a lot of people.
What does asymptomatic mean?
No symptoms.
Oh, no symptoms. Excellent. Okay,
Yes.
so you've got no symptoms,
No symptoms,
but you have
travelled
Yes.
to a high-risk area, or you know that you've maybe been in contact with someone. Then you've got two options. You can probably let your doctor know, but I would suggest at this moment to self-isolate.
Okay.
So mainly meaning stay at home as much as you can.
Right.
Ask some friends to bring some groceries over, leave it at your door,
Okay.
and then it is for 2 weeks.
Okay. Wow. It's
yeah.
like the plague.
We at
Yeah.
the moment it's just if you can postpone this, and the longer
Yes.
we can keep it out. Our main problem is our hospitals and health system.
Yes.
Even in Italy, they're not coping. In
Yeah.
China, they didn't cope.
Yeah.
We're not going to cope if everyone catches this virus and
Sure.
becomes sick.
Sure. That's
So
true.
yes.
Yeah.
So in preparation for that, stay at home if you can, and then if you develop any symptoms, let your doctor know. At the moment, we're trying to test everyone that is symptomatic with a travel history,
Yeah.
so that we can get our numbers right and see what's happening, and then we will advise on how to come in, what
Okay.
procedures are to follow.
So it's not necessarily to say that if you contract this virus that you're going to go into hospital.
No.
No.
80% of cases are mild cases.
Okay.
So that's also,
Okay. That's
there's
amazing.
bad news and there's actually good news
Well,
as well.
media don't report good news because it doesn't
Yes.
sell. So,
Yes.
what are the symptoms?
Mainly, it looks like patients are all starting with a bit of a sore throat,
Okay.
and then high fevers.
Okay.
Most of the cases got high fever, and then some coughing, 70% dry cough, some wet cough,
Okay.
and then you can get other flu-like symptoms like body pains and a bit
Okay.
of snotty nose and things
Okay.
like that.
All right. Cool. Dr. Visagie, thank you so much. We
It's a
appreciate your
pleasure.
time, and I hope that informs you a little bit more. It's not so scary. I wasn't scared in the beginning. Then after the Italy thing broke, I got a little bit nervous. Then Trump put a travel ban between Europe and the States, and then I fell apart. So, but now I'm feeling a lot better. I feel comfortable. But I also live across the road from the hospital, so I'm very happy. Cool. Thank you so much.
It's a pleasure.